all the regular things we're doing in terms of our ongoing programming. Just in case you have not seen a few things, on March 19th, we have our professional development conference, which Tiffany and a group of the MCAEL advisory group have been hard at work on. I think it's going to be wonderful. It's going to be an in-person reception on Friday evening for a little bit, and then virtual conference on Saturday. And you all know by now this is a biannual conference we do, and it is chock full of great resources, maybe some self-care and well-being things, some fun things, and we're just really excited about it. And then many folks always want to keep up on if and when we're doing our spelling bee, our adult spelling bee is our major fundraiser, May 4th. Make sure you mark your calendars at the Tacoma Park campus of Montgomery College. In between times, you know that we are always available to talk, always available to email with, and there's a lot of great stuff that's happening that we want to make sure that you know about, and you have a lot of great things happening that we want to make sure we hear about. So please do share with us your frustrations, your successes, your questions. One opportunity immediately for that tomorrow with me at noon, a Zoom, I call it a chat with Kathy. Come on for 2 minutes, wave and say hello. Come on and stay for 20 minutes if you have something you want to discuss or hear from other people. Super casual. Pass that around. It's open to anyone. I hope to be at some point getting to do these more in person so we can just sit down face to face and kind of break bread together and talk with one another. As you know, MCAEL's in the middle of our 15th year anniversary celebration. The actual 15th year was 2021, but you know how planning and all that went. So do keep us in mind. We're going to be featuring people of MCAEL as part of that, kind of in the theme of Humans of New York, for those of you who might follow that on social media or the book. The theme is People, Power, Potential of MCAEL, and we're going to highlight and interview some wonderful people who've been with us through the years. If you have suggestions for people that you think would be amazing to highlight their story, let us know. Send me an email with their name. That would be great. I will stop there because I know there are many more things. I'm just so excited about how we've kept going. I know I said this to the staff this morning. There is no shortage of days when any or all of us just feel tired and overwhelmed. There is a pandemic fatigue that I know is real. It's pervasive. Yet we saw your mid-year reports. We see what you're doing. There's a lot of great ongoing work. You continue to persevere, and we very much appreciate that because we know how hard some days can be, and certainly for the learners, by the list that's in the chat of the other things that they need to help their lives keep going. So we appreciate you. We appreciate your work, and I appreciate the fact that you took the time out of your schedules to be here today to participate in this meeting. Halima, did I miss anything that you were hoping that I would mention?
Oh, you covered it. Thank you.
All right, good.
And I put the Zoom link in the chat. Thank you. So we'll go ahead and get started. I'm going to invite our first speaker. I'm having a bit of Zoom trouble here, sorry. All right, there we go. All right. So we'll get started with our panel discussion. I'm going to invite Julien, Program Manager at Gilchrist Immigrant Resources. Julien, welcome, and I would invite you to introduce yourself before you start with your presentation. Thank you for being here with us.
Great. Well, thank you. First, I'd like to thank you, thank Kathy, Halima, and Tiffany, and everybody at MCAEL for inviting me to speak about the Gilchrist Immigrant Resource Center. So I'm Julien Labiche. I'm the manager of the Gilchrist Immigrant Resource Center. I'm delighted to be here meeting new people. I've been in the position for just over a year now. I come from the nonprofit and teaching backgrounds. I started out as an English teacher back in France, the country where I'm from. Then I worked as a French teacher, and then I worked in a nonprofit in Montgomery County serving immigrant youth. So I was very delighted to join the Gilchrist Center team in January last year. And I'm going to share a PowerPoint, a slideshow, and I'll go over the PowerPoint to let you know about what we do. So give me 1 second, I'll share my screen. Okay. If you don't see my screen, let me know, otherwise I'll get started. So the Gilchrist Center is part of the Office of Community Partnerships. It's part of Montgomery County government. So I will start then with a disclaimer, because there's sometimes this confusion. A lot of people think we are a nonprofit. We are not a nonprofit. We're a government agency, part of the Office of Community Partnerships, which itself is part of the Community Engagement Cluster in Montgomery County. So we've been in operations for 20 years. We started out in 2001, September 2001. With the goal of being a portal, a welcoming portal, gateway for success for immigrant residents in the county. So I'm not going to read the mission, you have it here, but there's one word I do want to emphasize here. It's the word connecting. The Gilchrist Center is really meant to provide connection between immigrant residents and the resources and services that exist in the county, whether they are government resources, local, state, federal, or nonprofit resources. But we're also here to provide a resource, a connecting resource for partners as well. And I'll explain to you what that means in a few moments. So what we do is there's two things: info and referral service, and then classes. So the class, we have citizenship preparation, English, and computer class. I will go into a little more details in a few slides. The info and referral program is something that started out as if you went to the Gilchrist Center physically at our office, you would see that at the counter there's going to be tons of information about other services and programs. You see flyers, you see lots of information. And a lot of this program was people coming to our classes and then seeing all this information and start asking questions. Oh, there's this and that, and then they get the resources. I will say that with the pandemic, in March 2020, when we closed our offices, a lot of the needs from residents, we started hearing a lot about it. And we saw a substantial growth in questions and inquiries about the services available, understandably so. And the info and referral has substantially grown as a product, as a result of this increase. And again, I will tell you a little more in a few slides. For the locations, we actually have 3 locations. So we have 3 offices. We are headquartered mid-county in Wheaton at the Westfield Mall. Westfield South Building at the Wheaton Mall. If you are familiar with the area, it's the building that next to the AMC Theater in the Party City. That's where we're headquartered. We also have a location up county at the 2nd floor of the Gaithersburg Library. And we have presence East County at the East County Regional Service Center. What the slide doesn't say is that we also have a presence at the White Oak Community Recreation Center. Note that the hours change and we're not full-time at every location. So it's important for partners and clients to look on our website, the status, the operational status, and the hours. So let me tell you a little bit about the info and referral service. So as I explained earlier, this program has really grown during the pandemic because of the increased needs and the requests we were getting. So because our offices were closed and are still closed right now, we we function by way of our info and referral line, 240-777-4940, which is the main number that we will route our calls to that. And we receive hundreds of calls every month, on average, around 300 calls, 400 calls from people with variety of needs that I put some of them in the comments, legal, classes, housing, financial assistance, you name it, health, mental health, crisis situations. And our job in this program is to take the calls and help people navigate and find the right resource or resources that are available to them. Our staff really endeavor to make sure that the people who call do receive a service or do get to talk to someone, whether it's with county agency or a nonprofit partner, to really get a service. So often we do follow up. We call people back to make sure that they get their service rendered. We know how difficult it is for people, especially immigrants and especially new immigrants, to navigate a system that is quite complex and complicated. So our goal is to provide the best referral possible, so that they get their question answered and again the service rendered. It's between Monday and Friday, 9 a.m. to 5 p.m. People will have the opportunity to leave a message after or before these hours, and we make sure that we return all the calls. So as the site says, referrals to government, local government, and nonprofit resources. We have many languages available. We have all our staff are bilingual, and we also have access to the language line provided by the county, which opens up access to hundreds of languages. So this program has really become a staple of our operations. One of our staff, Uni Hong, who manages our up-county site, is in charge of this program, and she has developed a resource guide for the staff who are on the call to make sure that it's quite comprehensive and make sure that we have a lot of resources and information available for the clients. Now I'm going to move on to the classes. So as I said, we have citizenship, English, and computer classes. So our citizenship preparation classes take place throughout the year. It's semester-based, fall, winter, spring, summer. They are free, and the goal is to ensure that people are well prepared for the citizenship exam. To enroll in this class, people have to be 18 years old and above. They have to be eligible to take the citizenship test. So they have to be a permanent resident for at least 4 years, or certain conditions that can be less if they've been married with a U.S. citizen. We really aim to prepare people. So there's a bit of there's quite a bit of information about the U.S. history background and civics. Preparation for the interview, a review of the N400 application, and then some practice for the people, the students, to be able to take the test, or practicing the language. Mm-hmm. Our computer classes are also semester-based, and they are designed to help people get a head start with software such as Word, Excel, PowerPoint, Google Docs, Google Suite, internet searches, internet access. They are free right now, $20 in person, and we'll probably revisit the fee. They are really meant to help people being able to, for example, to conduct a job search for people who may not have familiarity with the software needed to do that. So basic skills, basically, so that people can start producing some results as far as getting a head start in the county as a resident in the county. Another big component of our operations is ESL classes. So we provide ESL and English conversation. So there's ESL class, evening classes and Saturday classes. Those classes are at the very basic level for people with no skills or little skills in English through intermediate. Those classes are free with the exception of our ESL evening class, which requires a $30 fee. The requirements here again are 18 years or older and being a resident in the county. All those classes are on a first come, first served basis. And they fill up very quickly. The demand is high, particularly during the pandemic. To give you an order of the popularity of those classes, we, for the winter semester, which is just starting now, the registration was in January. We opened the registration on January 10. Less than 2 days after that, we were full. And we have wait lists from previous sessions. So if you work with clients who are interested in ESL classes, I strongly invite you to get on a mailing list. And so you can get some updates and information about upcoming classes so that you can let your clients know. We also have English conversation classes. So those are not registration based. And this is the only class that we offer that doesn't go through a registration process. And this class is, so no registration. We provide the links, the Zoom links directly on our website. It's drop-in, people can come any day. They just look at when the class is taking place. This is for people who have intermediate to advanced level of English and want to practice and meet new people. The social aspect of this class is also very important. A lot of people go to this class because it's fun and they meet other people too. They get to talk and improve their English and meet other people, even with the online format, which is less amenable to that. But so this is our contact information. Again, our main number is the number listed here, 4940. And our email address. Here's our website. I am going to actually, as I'm ending this slideshow, I will take you to our website and I want you to see a few things of note there. So again, we're headquartered in Wheaton, Veers Mill Road. I'm going to end, this is the end of this slideshow, so I'm going to end it and I will show you the website. So I want to tell you that we are in the process of doing a complete rehaul of our website. So what you see now is not going to stay forever. We're hoping that in the near future, we'll be able to launch the new version. And one of the big things about the new website is that we are trying to collect a vast array of resources that can respond to the needs of our population. We want to have this in a very organized way. There's going to be categories, so we try to make it very easy to navigate, and I think this will be useful not only for our clients but also for the partners. But in the meantime, this is the current version of our website. I want to draw attention to the homepage right here. If you scroll down, and I'm going to send this link in the comment, you will have our infographic, which is the main communication document that we want to push out to the community. It's offered in several languages. You have Amharic, Vietnamese, Chinese, French, Spanish, Korean, English, of course, and it has basically the basics of what people need to know about the Gilchrist Center. So information about our classes, about the info and referral program, the number to contact us, our email, our Facebook, and we want to push that. So I will put this link in the comment, but it's also on the front page of our website. If you go to our classes page, you will find information on how to register. You will see the online English conversation classes, the drop-in classes I mentioned earlier are here. And if I click there, you will see our flyer with the Zoom links. So anybody can join in if they come on Monday from 1:30 p.m. to 3. They click on this link and they'll be able to join. Okay, it's very free form. The other links are for the computer and citizenship preparation classes and the ESL classes. So the computer class is closed. The citizenship preparation is about to be closed because we're full, and the English classes are also closed. What I want to draw your attention to the fact that we want to also make sure that people have access to other resources when they cannot find ours. So we always have a list of other additional resources here. And if I click there for citizenship, you'll see a list of offerings, CASA de Maryland, Montgomery College, et cetera, for citizenship. Same thing goes for English classes. Here we have a list of additional resources. So I invite you to check out this page. If you see or know any resources, especially English that you know of that is not listed there, please let us know. Okay. I want to draw attention to the volunteer page. A lot of our classes are volunteer run. The English class and computer class are run by volunteers. The citizenship classes are run by contractors. So we rely a lot on and heavily on volunteers. So we have a volunteer program for people who want to sign up. We'll have to click here, and there's an application, and then we'll look at the application, interview folks. But we always appreciate the help of our volunteers. They're instrumental to the work of the Gilchrist Immigrant Resource Center. Finally, I want to draw your attention to our publication. This is where a lot of providers go when they need to find quick resources. We have a quick start guide, which is starting to get a little bit old because it was updated in 2019, but it's still very helpful and has quite a few resources. A quick start guide especially for new immigrants. It's a lot of people have given us quite a bit of praise about this document. I'm finding very helpful with a lot of resources available. I also want to show you that we have under Immigration Legal Services also a host of resources, Know Your Rights, Family Preparedness, et cetera, with a bunch of links. All this will be presented in a more user-friendly way in our new website, which I'm hoping we'll be able to launch very, very soon. So here you have the contact information, how to find us, our offices, and the hours of operation. Again, right now we are, our offices are closed, but we maintain our classes are online, and our info and referral service is going through the phone line. When we're reopened, the info and referral service will be available through the phone line, but also through walk-ins. People come to the center for information when they don't feel like they can get an answer through the phone. So that summarizes the work of the Gilchrist Immigrant Resource Center. Again, going back to the beginning of the presentation, I do want to emphasize the connecting aspect of the Gilchrist Center, and I really see the website also as a way to put resources together. When I started in the job, very quickly I saw that one of the challenges that our community is having is the difficulty to aggregate and put resources together. We know there's a wealth of resources existing in the county, but and because there are so many, it's sometimes hard to navigate them. And what we want to do with the Gilchrist Center is really be the central place where people can go, they can visit our website or call us, and immediately they'll be able to find the resource organized in a way that's easily understandable and that people can navigate easily.
Thank you, Julien.
Thank you.
Don't think we have any questions in the chat. Yeah, I don't see any
Hi,
questions.
Amoke has her hand up. Hello, everybody.
Yeah,
I see a
I
question.
sent Julien. Yes, I sent you a question. Would you?
Yeah. So there was a question from Amoke. Thank you for your question, Amoke, about the language line. So this, when our staff receive a call from someone who speaks a language that they do not speak, other than English, then our employees we call that the language line. It's It's a third party, it's a contractor. And that gives us interpretation service. And they have more than 100, I think 160 languages available. So we can be connected with somebody who's going to provide interpretation on the phone, so that we can converse with the client.
Great, thank you.
I'll make it real short. So is it a certain time? Is it within your regular work time, 9 to 5, or is this accessible?
That's a good question. I never occurred to my mind. I know that it's available during our office hours, for sure. I will look at it. Since we closed, we've been providing services from 9 to 5 with a language line. Once we reopen, especially when we're going to start hosting classes from some of our partners, our office will be open certain hours a bit later. So we haven't determined that, and that's a good question. Again, I've been in this position for just a year, and I have to look at that. What happens with the language line if we were to use it in the evening?
Great, thank you. And Julien, would you be staying with us throughout the event?
Mm-hmm.
Okay, great. If we do get some questions in the chat and you have the time, please do respond it in the chat. We're 5 minutes behind the agenda. I do want to honor the time that we give to all of our speakers. So without further ado, we'll invite our second speaker, Jeannette. She's a pastor at Seneca Creek Community Church and also the executive director for the Gaithersburg Care Hub. Welcome, Jeannette, and I would invite you to introduce yourself briefly before your presentation.
Okay. Thank you. I do appreciate so much this opportunity to talk with you all. Thank you to Kathy and Hamala for inviting me. And a special shout out to Yvonne Ellis, who is on the call here as well. She has been a volunteer director for our ESL program here at Seneca Creek for a decade. And so I've been able to see firsthand the incredible work that you all do and the need that is out there. And I just so admire and am inspired by the incredible work that's being done by so many of the English programs in our county. I'm going to share my screen here real quickly to talk a little bit about the Gaithersburg Cares Hub. Okay, so there we go. So the Gaithersburg Cares Hub started in March of 2020 as a response to the COVID-19 pandemic. And we were started in partnership very much with the city of Gaithersburg and still partner very heavily with the city of Gaithersburg today. And the partnership originally started to address the need for food. As you remember, when everything shut down very quickly, and we went home to flatten the curve, and we ended up staying home for about a year. There were many people, many of probably the clients that you serve in English classes and others who lost their jobs, did not have savings accounts, some of them were sick with COVID, could not use Instacart to get food. And so we became a service consolidation hub, pulling in resources and food from the community, packaging those resources and getting them out to families in need, especially families that needed to quarantine because of COVID. And then in September of 2020, our church agreed to continue the Gaithersburg Cares Hub as a permanent county service consolidation center. And so what that means is we are a private organization, but we are working in partnership with businesses, with county organizations. I think I have some of them here to address mainly our biggest service right now is around food insecurity, but it's not the only thing that we do. But we are working in partnership with Manna Food, the Community Services Foundation, many churches in our area. And quite honestly, we have a list of about 50 private, public, government organizations that have partnered with us, way too many that I can fit on the screen. So all that to say, We are one of 8 service consolidation centers in Montgomery County that you should know about. And the idea behind the Service Consolidation Center is to put the resources that our neighbors need in their local communities so that they can get access, especially to food, near them. And they don't have to, take a bus to, several stops in order just to be able to access food. And so what we've done in 2021, we distributed 1,200,000 pounds of food. We service an average of 924 households a week in 2021. One of the things that I don't know if we're the only ones that do this, but it's somewhat unique, I know, in that we don't ask for a lot of information. The only thing that families need to tell us if they get food from us is how many people live in their house. Are any of those household members seniors over the age of 65 or children? And what is their zip code? That's all we ask. We do not ask about income. We do not ask about citizenship. We do not ask their address. And so that really lowers the bar for those who have maybe have barriers or concerns about giving out private information. They can still get food from us. We serve all people in our community. It doesn't matter your race, your religion, your gender. There are no barriers. We don't ask about income. If you need food, we will give you food. We do provide assistance for health items and hygiene items as people request them, as we find people have needs. So for example, sometimes there are families that are homesick with COVID and they need Tylenol, or they may need masks, or they may find that they don't have good cleaning projects or products so that they can clean their house and keep it safe from COVID, from other people getting COVID in their home. So we also will provide those if requested. We connect people to other resources needed. So we do have a caseworker on site 2 days a week. And so clients can make an appointment to meet with her. She does speak Spanish. She does not, I don't believe she speaks any other language. So if there's a need for an additional translator, we would just need to know that and to make arrangements for that. And so this is a way that obviously your clients, if they have bigger needs or just challenges that they're facing, Alicia, who is our case manager, can meet with them, understand their needs, connect them to other resources in our county. Oftentimes people come to us for food, but then we're able to get to know what their greater needs are and connect them to other resources. Engagement, just as I said earlier, we've got about 50 partners, public, private businesses. And so one of the things that we're really working on, and we really see ourselves here in Gaithersburg as wanting to be a leader that's bringing organizations together. We all care about our community. And so how can we collaborate better? I want to know about the ESL programs that you all are doing and where they're located so that we can connect people with your programs and then also give your organizations opportunities to collaborate with us and volunteer opportunities as well, which is the last in the CARES is S. We, that 924 households that we've serviced is done mainly by volunteers. We have 3 full-time staff, and other than that, we work only through volunteers. And so we're grateful for the many people in our organization that come and give their time at the Gaithersburg CARES Hub. So some of the ways that we may be able to help your clients is we have what is called a walk-up choice pantry that is open on Mondays and Fridays from 2 to 3 p.m. and every first Saturday of the month from 10 to 11. And I'm realizing that is not actually shown here, but it is also open on the first Saturday of the month from 10 to 11 a.m. And so this gives shoppers the opportunity to come in and they can pick the food items that their family will best enjoy, so that they can get what they really need and what they really want. And so our clients really appreciate that. The other thing that we have enjoyed with our choice pantry is it's given us the opportunity to really learn what foods our clients want. And so we've been able to change what we're offering in order to meet the needs there. We also do community distribution. So some of our neighbors we know have a challenge accessing food because they don't have transportation, or maybe they just can't leave their neighborhoods or their homes because they have a loved one who is sick, or they have, small children at home. So we do in-community distributions on a regular basis. I've listed here for you some of the apartment complexes that we go to every month, and we bring food there. We work with the apartment managers so that they know we're coming, and they help us to get the word out. Now, I do want to say, folks do not have to live in those apartment complexes to meet us and get food from us. If they show up to where our distribution is on that day in those apartment complexes, we will serve them as well. We're also doing drive-through distributions at Flower Hill Elementary, Gaithersburg Elementary, and Brown Station Elementary. And I believe most of those are happening bi-weekly. We occasionally do one-time, or I should say occasional, drive-through distributions at other schools. We've done some at Forest Oak Middle School, and that happens really when the school community asks us to come and do that. And then we will let the community in that area know that that's happening, so that they you don't have to attend that school in order to benefit and get food at that distribution. We are doing limited home deliveries, and I say limited because, we do have a maximum amount of deliveries that we can service in any week. And so what we're having to do is we prioritize those deliveries. So those deliveries go to, first of all, if there's someone in our area who is, their family has COVID and they need to quarantine, and they need food, we will deliver to them for a month to give them time to improve and get better. And so you can make a referral to us, and we will make sure that those families get delivered to their doorstep, 2, sometimes 3 or 4 bags of groceries, depending on how many people live in their home. If there is a neighbor who maybe is going through chemotherapy or major treatment for a critical illness that impacts their ability to really get out of the house and to shop for themselves, or maybe they're immunocompromised and they can't get out because of COVID, well, then we will be able to also deliver to them and make sure that they have food access, during their treatment times. Occasionally, like some of the other, I would say, critical areas, occasionally we will have single moms who maybe just gave birth, and so we can deliver to them for a few weeks until they can get to the point that they're really able to get around and get out and do shopping. So all of those things that you realize, all of us have these situations in our life where we are homebound, or we just can't get out to get groceries. So whether you have the ability to pay or not, if you need the delivery, we will deliver, because we're not asking for income information. But as you would imagine, if a client already struggles to be able to get access to food financially, and then they have also a crisis or an illness, it becomes even more complicated. So we want to be here as a resource to help them and to serve them through that crisis. The other thing that we're doing a lot of at the Gaithersburg Cares Hub is serving families who need diapers and infant formula and sometimes baby food as well. So what we have found is many of the even if someone gets SNAPs maybe, and they're able to get some food, they're not able to buy diapers with supplemental nutrition program. So we give out up to 100 diapers per child per month. And right now we're serving somewhere in the neighborhood of 327 babies a month. And so if families need to get diapers, they can go to senecacreek.org/cares hub, and there's a link there that says I need diapers. They can click on that link and make an appointment, and our appointments are available on Tuesdays or Wednesdays. We also will deliver diapers to homes with food if that is a need. Now, I do want to say when it comes to diapers, we do ask for a little bit more information, and that is required because of the grant provider that is providing diapers requires us to make sure that there really is a child and that it is your child that needs diapers. And so we need like a birth certificate for the child, or an insurance card could work, just something to prove that you have a child that is an infant in need of diapers. And we will also need the parent's name, the baby's birth date, and the address. That's all we ask though for that as well. Okay, that is the end of my PowerPoint, but I do want to show you, if I can real quickly, a couple things on our website as well. This is our website. So if you were to come to senecacreek.org/cares hub, and I will put these links in the chat. Here's our website where you can send your students and learners if
Jeannette,
they need food. Yes.
Sorry, we can't
Go
see the website.
Oh,
We
you
still see
can't. Okay.
presentation. Yeah, you'd have to reshare.
Thank you. Okay, then let me see here. How do I do this? Let me do this. Maybe I need to stop and then reshare. Yes, let me do that. Thank you for letting me know that. Can you see the website now?
Yeah.
Okay, fantastic. So this is the website. If you scroll down, you'll see this is where they can just click, I need food or I need diapers. If you or anyone that you know would like to learn more about volunteering, they can do that as well. And then when they click on, I should say, oh, also down at the bottom. So here is some emails. So if you were like, I don't know what to tell my students or where to go, just tell them to email cares@senecacreek.org, and they can let us know what their needs are. There's a telephone. They can leave a message. That phone does not get answered all the time, like with a live person, but we do check the message every hour. So if they leave a message, they will get a call back. So that's important to know. And then the other thing that I have on here I wanted to show you is Montgomery County. Let me make sure, yeah. So here is a food distribution and giveaway calendar. So that's the other thing. So maybe some of you serve learners who aren't in the Gaithersburg area and we are not the most convenient place for them. You can send them to this website on Montgomery County, Maryland.gov. Look for the food giveaway calendar, and you'll see here they show where all the food giveaways are during the week. And so some of the other hubs are also listed here. As I said, there's a hub in Rockville, in Wheaton. There are 3 in Silver Spring. There's 1 in Olney and 1 in Germantown. And so they can come here and find out. At all of the hubs, they only ask those questions that I told you about in the beginning, about zip code and the number of people that live in their household. So it's a real low threshold, no barriers to be able to get food. And yeah, I think that is the end of my presentation. I'll be happy to answer any questions, and I will stick around for the rest of your meeting if other questions arise.
Wonderful, thank you. Rudy, do we have any questions in the chat?
Actually, no, not at this point.
I see a question for an email address.
I'm sorry, what was that question?
What's the email address to contact you?
Email address.
Yeah.
Okay.
Great. And is there a referral form for home deliveries?
Thank you. Yes, there is a referral form that you can access on our homepage of our website, or you can email it directly to cares@senecacreek.org.
Great, thank you. In the chat, I also put the direct links for Gilchrist and the Gaithersburg Cares Hub. You can click on there as well.
Thank you.
So we'll go on for our next third panelist. With us, we have Nick, Legal Director at CASA. Welcome, Nick, and I would invite you to introduce yourself briefly before your presentation.
Sure. Thank you, Halima. Thanks for having me here today. So my name is Nick Katz. I'm the Legal Director with CASA, and I have a brief presentation that I'll go through explaining not just the legal services that we offer, but also about CASA as an organization. Because as many of you might know, but some of you might be less familiar with us, we are not only a service provider, but also a community organizing outfit and a really a space for folks to come together in community to join a movement to facilitate positive change within their communities. So I will try to share my screen if I can here. There we go. Great. Can folks see that?
Yes.
Great. Okay. So this is a little explanation of who we are. We are the largest grassroots immigrant advocacy organization in this region with more than 36 years of experience and more than 120,000 members. We were founded in 1986. And we blend human services, so the ESL classes that Shannon runs and the legal services that I operate, in addition to health services and many other services, with community organizing and strategic campaigns to serve the full spectrum of needs, dreams, and aspirations of our members. So I'm going to talk about each of those a little bit in this presentation, and also give you, the best way to access the resources that your students might need, including those of my team, the legal services. Let me see if this can work. Can folks see this video?
Yes, but we can't hear it if there's an audio.
Yeah, there is audio, but I can't hear it either. Well, anyway, this is a video that's available on our website. I'll share the link in the chat, and maybe in the interest of time, we can just skip it, but it gives a little bit of background on us as an organization and our members. So briefly, this slide represents our mission, and it's a short one, so I will go ahead and read it. We are aiming to create a more just society by building power and improving the quality of life in working class and immigrant communities. And our vision for the future is that our members will stand in their own power with our families, living free from discrimination and fear, and our diverse communities thriving as we all work with our partners to achieve full human rights for all. So you can see that in the picture there, many of our members gathered together to express the essential nature of immigrant communities in our country. And so how do we do it? I think the real foundation of CASA's work lies in our community organizing, and all of our members are invited to join in our different committees that I'll talk about a little bit in a moment. And I already mentioned the sort of combined holistic approach that we have to engaging folks who come into CASA through community organizing, the advocacy, and the service components of things. So we operate not just in Montgomery County, although we have something like 30,000 members in Montgomery County and certainly serve a lot of Montgomery County residents every year, but throughout Maryland, in Virginia, in Pennsylvania, and most recently we opened an office actually in Georgia, and have members in, I think it's 46 states across the country. So we have a strong history in Montgomery County, Prince George's County especially, but have grown to operate really across the entire country. And so this is how our organizing committees are structured. You can see the explanations actually in Spanish there. And this is just to demonstrate really CASA is a membership-led organization. So we have a leadership committee or a leadership council that's set up of folks who are elected out of the different organizing committees that we have. And these are the folks who make the decisions about what our organizational priorities are going to be, both in terms of what services, we are going to deliver to the community, as well as what campaigns we're going to prioritize, what change that they want to see. So that's it's just a little visual representation of how CASA is structured in terms of our leadership, and emphasizing that it is really our members and the people who participate in the organization who lead our work. And so getting more specifically to my team and how we further our mission in legal support, we offer an array of direct legal services. One thing that we have are Know Your Rights presentations. So we do these periodically in a variety of different ways, both engaging in our organizing committees, at our worker centers that we have in Montgomery County, Prince George's County, Baltimore, throughout the state, but also working with partners, including in our ESL classes to educate people about their rights. And if there are individuals or groups, organizations on here who are interested in partnering on a Know Your Rights presentation, feel free to shoot me an email. I can put my email in the chat and we can share that out so that we can see if we can come and do some of these presentations for your students if that's appropriate. And so these are on things like how to respond to immigration enforcement actions, how to prevent eviction, how to protect your right to work, and a variety of different areas. In terms of direct legal services, we have weekly intakes for our members in our 3 core areas. That's immigration, employment, and housing. In immigration, we see anywhere from 1,200 to 2,000 people a year come through for basic legal consultations. And what we generally do is analyze the person's situation, determine if they're eligible for some form of immigration relief, and if it's not a case that we can take on, try to offer them appropriate referrals. The area where we provide the most sort of full representation is DACA. We're the leading DACA service provider. So if you do have young people who are DACA recipients or maybe DACA eligible, please feel free to send them our way. We do 500 to 600 DACA applications every year in immigration, but we can advise on the full sort of spectrum of immigration related issues outside of probably employment petitions or anything sort of business immigration related. We do focus on more the humanitarian forms of relief like asylum, temporary protected status, and things of that nature. Employment, the variety or the bulk of our work is focused on wage theft prevention. So individuals who, their employer has failed to pay them the wages they're owed, or they have put them in working conditions that may be dangerous or facing discrimination for whatever reason. We can help folks recover those lost wages and give them legal advice in terms of how to navigate employment environments where there may be illegal conduct going on. In certain cases, depending on the prevalence of the issue, if there's a group of workers that have been impacted, we may also partner with our community organizers to put pressure on the employer to improve conditions and vindicate the rights of the individuals who have been victims of wage theft or other abuses. And then housing, this has been a really big issue over the last several years, as everyone knows, right? With the pandemics, our housing support on the legal side has really grown. And right now we're focused on making sure people have access to rental assistance who need it. So we partner with our Health and Human Services team to help do rental applications in Montgomery County and Prince George's County, Baltimore, and elsewhere. And we can also help to fight evictions. We have attorneys on staff who can do eviction defense where it's appropriate. So folks who need assistance there, we can provide that assistance. And at the bottom here is just a link to the legal page of our website focused on our services in Maryland. There's also on that link a link to our Know Your Rights materials related to immigration issues. And this page, and this will be up at the end of the presentation as well, but the way to access services is really, the primary entry point is our hotline, which is 1-866-765-2272. That's 1-866-765-CASA. And we offer free or low-cost services to our members. if folks aren't members yet, the website link at the bottom here has a link to how you can get membership, or you can just call that number and indicate that you are interested in membership, and they can direct you to the proper place within the organization. That number is not only our legal hotline, but it's the main hotline for the entire organization. So whatever services or needs an individual has, that really is the place they should call. In addition to what I just mentioned that our legal team does, we do also have citizenship services that are offered through a different department, the health services, the ESL classes that Shannon runs. Calling this hotline is really the entry point for any type of needs that someone may have at CASA. So it's a good number to know, and please feel free to share it with your students or other constituents. Really briefly, I wanted to run through just a case study of one of our clients to indicate like how we do our work. This is Roxana Oriana Santos. She's been a member of CASA for more than 15 years now. And she came to the United States in 2005, got an in absentia deportation order in 2006, meaning that the immigration court ordered her deported, even though she didn't show up for her hearing. She didn't know about it. And so then in 2008, she was racially profiled in Frederick County and detained, separated from her 1-year-old baby. And we were able to get her released and actually won a Fourth Circuit case vindicating her rights and showing that there was a violation of her constitutional rights in that detention. But her immigration case continues. And she was redetained right before the pandemic in 2019. We again had to really advocate to get her released, and we're continuing even after more than 12 years to fight her immigration case. So some of the folks that we see, we help, they come in and we're able to assist them in a relatively discrete timeline. Some of them are with us for decades or more. And another way we do our work is through impact litigation. So we have cases challenging the termination of DACA, which has been successful, TPS, the public charge rule, the citizenship question they tried to add to the census. I mean, this is really a place that CASA expanded our legal work during the previous administration, was able to protect and defend a lot of really essential programs for immigrants. And we continue to litigate these cases today. We also do it in other areas, including in housing. We have a case in Montgomery County right now with a mobile home community that has been experiencing significant overcharges and other abuses by landlords. So we have worked together with a group of tenants there to try to protect their rights. And then we have different campaigns that we run at the state level, but also locally in Montgomery County, Prince George's County, and in Baltimore City, as well as other places. Trust acts to try to separate out law enforcement from immigration enforcement. Dignity Not Detention, which just passed last year, ending ICE detention in Maryland. The Driver Privacy Act, which protects folks who get driver's licenses from having immigration use that information to try to deport them. Economic justice, the DREAM Act was passed 10 years ago now in Maryland, allowing access to education for certain undocumented youth, raising the minimum wage, last year expanding the earned income tax credit for folks who don't necessarily have social security numbers, access to counsel on housing justice. We're fighting for increased funding for access to counsel for detained immigrants this year, folks who are in ICE detention. So if folks are interested in engaging on that campaign, that's something that we are working on in Annapolis this session, and would welcome any support that folks can offer. And so that ends a sort of brief overview of our services. Again, I'm happy to answer any questions folks have. There's that number again, along with the link to our membership page if folks are interested in becoming members and engaging with the organization, or if they have a need for legal services or other services that CASA might be able to offer, you can call that hotline. And with that, I will go ahead and answer any questions folks have.
Thank you. I don't see any questions in the chat. Uh,
Great. I hope that was super clear then. I'll stop sharing.
I do see one now. Has CASA resumed providing IDs?
Yes. So it varies by center, right? And so my recommendation would be to call the center before you go in. Some prefer that you schedule an appointment. Some will take walk-ins, but we are able to give folks IDs. And just by way of for folks who may not be familiar, CASA membership is generally $35 a year, or we have what's called a sustaining membership now, where you can pay $5 per month. And then for an additional $5, we do have a photo ID that people can access. So our centers are able to get that to folks, and that is open now. I would just again recommend like calling whichever center you're going to go to get that, to make sure you go at the right time and do what you need to do.
Thank you. And are the Know Your Rights presentation done in Spanish?
They can be, yeah. Most of the time we give them in Spanish. You can do Spanish, English. We do have a few French speakers, so we could potentially do it in French, but in general, it's in Spanish, yeah.
Wonderful. Thank you so much.
No problem. I'm having trouble stopping sharing. Let me see if I can figure this out. Stop share. There we go.
Thank you. So we'll get started with our final panelists today. Agnes from Community Reach of Montgomery County. She is the executive director there. Thank you, Agnes, for being with us, and welcome. I would also invite you to introduce yourself briefly before your presentation. Oh, you're on mute.
Good afternoon, everybody. Thank you very much for the invitation. I appreciate the opportunity to share and speak more about the Mansfield-Caseman Health Clinic, which is a subsidiary of Community Reach of Montgomery County. Community Reach of Montgomery County is the umbrella parent organization, and we also provide English as a second language services, housing services, senior services, emergency assistance, but I understand we are focusing today on the healthcare portion of our services. The Mansfield-Caseman Health Clinic is part of what I call the Montgomery County healthcare system, which is part of Montgomery Cares. Back in 2006, I believe, more than 15 years ago, our county executive created this Montgomery Cares program, which is a public-private partnership between Montgomery County and different nonprofit safety net health clinics to provide medical care to low-income adults and insure Montgomery County residents. To fast forward 16 years, today, Montgomery Cares has 10 different clinics, and the Caseman Health Clinic is one of them. So 95% of our patients are uninsured. They don't have access to any other health coverage other than what we provide under Montgomery Cares, and is how they can have access to health care. We also see Medicaid and Medicare patients, but at the moment that is a very small portion of our patient population. The Caseman Health Clinic is located in Rockville downtown, although right now we are in a temporary location because the last week of the year, actually on Christmas Day, our clinic was affected by a flood coming from the neighbor above us. So we are temporarily operating from a local church, Rockville United Church, but our permanent location is in Rockville downtown. But our main services are certainly to give access to healthcare to low-income uninsured adults. We provide primary care, anything that is related to health, primary care in general, laboratory services, pharmacy services, certainly medical consults with the primary care providers. And in addition to primary care, we also provide specialty care. We do have a team of our own specialists in-house. We have podiatry, gastroenterology, gynecology, pulmonology, behavioral health, and patients who come to Caseman Clinic and may need that type of specialty can see the specialist fairly quickly. If for any reason a patient needs specialty care that is not part of our team of specialists, we do have access to 2 network of specialists when we can refer patients for specialty care. Also, the 10 Montgomery Cares clinics work in collaboration. For example, in the same way we have our own specialists, other Montgomery Cares clinics also have their own specialists, and we refer people to each other. For example, the patients remain in their own home clinic for primary care, but they go to other clinics for specialty care if needed. For example, if I am a patient of the Caseman Clinic and I need to see cardiologist, and we don't have a cardiologist in our own clinic, we can place a referral for cardiology in one of the other Montgomery Cares clinics. So we talk among ourselves, and we know the availability of specialists that we have so that we can refer people to each other. So certainly making sure that the patient gets what they need in terms of primary care and specialty care. Another type of referrals that they need, such as radiology, for example, whether it's an MRI, X-ray, different radiology services. We do work with a combination of radiology clinics and Adventist healthcare, and we can get either reduced prices or free sometimes for our patients. Certainly the last 2 years has been an adjustment for everybody in the world, but certainly in the area of healthcare with the pandemic. And the Caseman Clinic, first of all, has remained open every single day since the pandemic started. We have been there for our patients to continue to provide regular medical care, of course, but certainly we have adjusted our services due to the pandemic. We have done that little by little, following very closely the CDC guidelines and recommendations, but we certainly expanded our services to telehealth. And although telehealth was heavier in the first year of the pandemic, we continue to do that for patients that telehealth may be a most viable option than coming in person, especially on a very cold day this winter. And we also provide COVID testing and vaccination. And in the testing and vaccination, we do it every Saturday. I will put in the chat our phone number and our website, but people can call for an appointment for vaccine, and if they call for an appointment, the service is quicker, but people just can also show up. I will put also the Maryland Vax website, but if people are looking for a vaccination clinic through the Maryland Vax website, if they type the zip code and they happen to be in Rockville, our clinic will show up and people can sign in directly for an appointment for vaccination. Health education is something that we do to describe the importance of health literacy, and literacy in general certainly MCAEL does a great job of with all our providers for English as a second language classes, and we know many of the people that we serve sometimes don't have the regular literacy that they need to face many different issues in life. And that's not different from health literacy. Let me share an anecdote of a patient who came to us and to emphasize how important health literacy is, and also being bilingual and cultural appropriate to serve our patients. 75% of our patients are Spanish-speaking patients. But we had one anecdote of one patient who came to us, and he came from Texas because he was visiting family, relatives in Texas as a transitional time before he made it to Montgomery County, where his family was. And while in Texas, he had to go to the emergency room, and he was given a bottle of medicines for what he was facing. So he came to our facility, and he had the bottle from the emergency room, and he didn't understand well how he needed to take the medication. And then the label on the bottle said, take one tablet once a day, okay? Here is a mini Spanish class. The word once in English means number 11, once in Spanish, okay? Same spelling, O-N-C-E. In English means once, in Spanish means once, okay? So this guy asked our doctor, I don't understand why I need to take 11 of these pills. He said, what do you mean 11? Well, that's what the bottle says. I saw once in there, and that was once. And we said, oh my goodness, how important. So certainly explaining to him what once meant, but mainly to be so careful with instructions to patients. The only word that he recognized from that bottle was O-N-C-E, once or once. And certainly that was an eye-opener for us on how important health literacy is. So after each appointment with our patients, certainly our medical staff go over the discharge instructions and things like that. But to mention how important that is. We also had a situation of a patient who hadn't seen a doctor like in 15 years. And he came because he had headaches, and he was fairly young, like in his 35s, 40s. And he used to work in construction. So he thought that he was always tired because of his job. We did, of course, all the intake and screening, and he happened to have his blood sugar in a level of 800. And we said, oh my goodness, have you checked your blood sugar before? No, I haven't seen a doctor in 15 years, but I'm always tired, etc., etc. So this patient came to us weekly for a month or so until he got stable with his diabetes. And part of the health education was also, well, how much sweets do you eat? And he said, no, I don't eat sweets. I don't eat cakes. I don't have ice creams. I do love Coca-Cola in the red can, and I eat and I drink orange juice, but that's not sweets. And then that was another whole important health education, not only the sweets, but also how his diabetes. And then certainly he got stable with the diabetes and things like that. But again, I mentioned those anecdotes because they show the importance of how someone needs to be in compliance with his health and the support of health education and the interaction with the doctor and the medical staff on on how someone needs to understand the different implications in their healthcare. So I think in an overall description, that's who we are and what we do. And if you know people who don't need health insurance and can be referred to us, certainly the Caseman Clinic, as I said, is part of the Montgomery care system, and happy to welcome patients come our way. Thank you again for the opportunity to speak, and I'll be happy to answer any questions.
Thank you, Agnes. I don't see any questions in the chat. Do we have any questions? We do have some time, so you could unmute yourself also to ask the question. As you were sharing the anecdotes, I started thinking about when I was in college, I did medical internship in Seattle, where I would go to doctor visits with some of the immigrants, particularly those who spoke Hindi, Urdu, and Somali. And it was just always very interesting when the patient, it was interesting, but also the importance of having a common language between the patient and the doctor to avoid misdiagnosis, to avoid any future health hazards as well. So thank you so much for sharing those.
Thank you. And the and even if the patient may have some knowledge of the English language, and we certainly welcome when they do, sometimes they prefer to speak in their native language when they are dealing with the doctor, because they want to make sure that they know the instructions and how to follow up and how to be in compliance. And we want that as well. Based on the experience that I share, we want to make sure that people know how many tablets they need to take and how often, and that they have the right instructions for their proper medical care. Mm-hmm.
Absolutely, yeah. And also for people who do direct translation of the language. One particular incident that I'm thinking about that was sort of funny was I received a call, and this was in Seattle, I received a call from the doctor who said, I'm with this patient here, they're talking about burning, and burning makes sense when you translate from Somali, but not so much when you translate it into English. But thank
Sure.
you.
I see a comment and a question on the chat about mother-child health. Thank you. Let me talk about that. We do partner with the county and the 5 area hospitals in Montgomery County with a program that is called the Maternity Partnership Program. If an uninsured woman is pregnant, they need to see our primary care provider first, and then our primary care provider will refer that person to the maternity partnership program. The maternity partnership program covers the prenatal care for the 9 months of pregnancy and the delivery of the baby, plus 1 appointment after the delivery of the baby. Having prenatal care and delivery a baby for an uninsured person is something that may cost, I don't know, $20,000. And through the maternity partnership program is $500 for everything, the 9 months of prenatal care plus the delivery of the baby. The Montgomery Cares program sees adults only because healthcare for children is covered by either the CHIPS program, which is Children Insurance Health Program, or Care for Kids. So children should be able to have coverage through the 2 different children's program. If the pregnant woman during the 9 months of pregnancy experience some health issues as a person herself, for example, I don't know, sore throat, stomach ache, something that is related to the health of the mother, and it doesn't have anything to do with the baby, that person continues to come to our clinic for regular health care. But if it's anything related to the pregnancy, through the maternity partnership program, that woman is assigned to a GYN doctor, and anything that is related to the baby, the person continues to go to the GYN doctor, and then that person will be assigned a hospital as well, where the baby will be delivered.
Thank you. I would like to thank all of our panelists, Julien, Jeannette, Nick, and Agnes. Thank you so much for taking the time to be here with us and also for preparing for this meeting. I hope that this was a meaningful meeting for all of you, that you have learned at least about one resource that you can share with your learners and their families. In a follow-up email, I'll share the PowerPoint presentations with you. I did notice some links that came through in the chat. I'll share that as well. Right now in the chat, I'm going to put a link to our survey. We do want to continue to make these meetings meaningful for you. So we would appreciate if you could take a minute or two to respond to those survey questions.
Thank you.
You're welcome. Thank you again. And we still have 4 minutes left. I'll stop recording.